Here are 3 words that can chill you to the bone. Chronic back pain. Is there any hope of relief? Let's ask Dr. George Gerges.
Correct.
Okay,
Correct.
Sorry for that. Dr.
Right.
Gerges is with Fairview Hospital. Thanks for joining us, Doctor.
Thank you.
Now, what does chronic mean?
Chronic means the back pain that persists beyond 3 months.
And what would cause that?
There are actually too many reasons to cause back pain. We can spend hours of talking about reasons, but I can say that the treatment should be geared towards the reason.
Old age?
Old age could be possibly just degenerative process going on in the back, and the back structures like facet joints, like disc itself.
All right, so you mentioned treatments, and you said treatment should deal with the cause. What are the best ways to treat chronic back pain today?
Treatment should be multimodality approach, not like single treatment is not sufficient to treat chronic back pain problem. For example, medication, narcotic technique, non-narcotic therapy should be also include physical therapy and include some minimally invasive procedures that we as chronic pain physician do, like injections.
When you say medications, what are we talking about?
We talk about over-the-counter medications like the regular non-steroidal anti-inflammatory agents, Aleve, Motrin, Excedrin, and if patients are allergic to these medications, they can seek other alternatives.
If you take something like Aleve or those other Motrin, I mean, are we talking about taking that for the rest of your life, or does that cure it?
There is no such a thing. It's cure versus non-cure. It's every patient respond different to treatment, and again, it depends on the reason for the pain.
Is it safe to take Aleve or Motrin or these kind of medications for long periods of time?
Actually, the recommendation is not to exceed 3 months of that because of the risk of gastric bleeding and renal dysfunction as well. And again, every patient is different.
You mentioned injections. What are we injecting?
We inject long-acting cortisone in general, and this would relieve any inflammatory process going on and improve the function and decrease pain scores as well.
What are the, if those things don't work, if physical therapy doesn't work, what's the next step?
Well, again, it depends on the reason for the pain. If severe disc herniation pressing on a nerve root and causing motor weakness for the patient, then surgery would be an option here. We work in conjunction with the surgeon, and if we see that the condition necessitates a surgical intervention, by all means, then we go for that.
You mentioned multimodal, so before we get to surgery, you would try a variety of different things potentially together?
Yes, absolutely, like medical management, physical therapy, and injection therapy, and if that failed, then surgical option, if it's available, then we go for that.
And when you say if it fails, what's the test? Is it relief from the pain forever, or is it just manageable? How do you
Well,
determine?
again, every patient is different. If you say that I don't want surgery as an option for me, and I just want to, I will take pain a little bit, and I will go, and as long as I'm functioning and working, and I don't need surgery. Then some other patient will say, no, I need this to be 100% cured. I want surgery.
And
so
surgery is designed to be a cure.
Well, it should be, but sometimes, this is why we have a term failed back surgery, and we still deal with that a lot.
Right, right. Well,
Yes.
Doctor, thank you.
It's my pleasure.
People are so concerned about back pain, and it's great to have that information.
Thank you. My pleasure.
If you suffer from back pain, there is hope. Contact Fairview Hospital with the number that's coming up next. It's very important. My thanks to Dr. Gerges for joining us today. Thank you.
To find out more, call Fairview Hospital at 216-476-7000 or check out their website at www.fairviewhospital.org. Next, avoid a common identity thief.